Let's talk about pain, a podcast from the Quebec Pain Research Network. In each episode, we discuss the latest advances in pain research with guests from across Quebec in the health and research communities. Enjoy your listening.
Hello and welcome to this new episode of Let's Talk About Pain. My name is Mael Gagnon, and I'm a doctoral student in psychology at the University of Montreal under the supervision of Pr Gabrielle Pagé. In today's episode, we're going to talk about phenomenology and pain, and I invite Mikael Cleryd from Södertörn University in Sweden, who is a clinical psychologist and a researcher in the field of practical knowledge. I invited Mikael because he has a deep understanding of phenomenology and its practical application to psychology, which is essential to better understand the experience of people living with chronic pain. Hello, Mikael Cleryd. Thank you for joining us today. Can you introduce yourself?
Thank you. It's nice to be here. I'm doing my doctoral thesis in the theory of practical knowledge, which is it's not a very common subject within the academia, but it's about trying to see what kind of knowledges we use in our everyday lives, especially in professional life. So it's based very much on an Aristotelian definition of knowledge. And one of the definitions of knowledge is phronesis, which means the sort of embodied knowledge that we use every day that we don't even think about. So that is what I am interested in. And I'm a psychologist and psychotherapist, so I'm focusing on practicing psychotherapy and what kind of knowledges we use when we do that. So that's basically what I'm trying to understand. And I'm focusing on a certain phenomenon that is called procrastination, which is more and more talked about, and which means that you are postponing or delaying tasks. And I'm curious to know what it's really about from a phenomenological perspective. So that's what I'm writing about.
I recall because we talked before, and the embodied knowledge I think was especially relevant just because that's really connected to the field that I'm interested in, pain. So I'd like to hear more about that aspect.
Yeah, it's very interesting. Well, I think in a way it's hard to explain embodied knowledge, but basically it's about a kind of knowledge that you have that you are not fully aware of and that you are practicing in many different areas in life. You just know how to do things, but you don't consciously know it. And it's very much connected to intuition and gut feeling and things like that. So it's just accumulated experience that you have in your life and connected to some kind of thinking as well, some kind of deliberating that you do, maybe not fully consciously, but at the same time as you are dealing with situations. So embodied means that it's not generally a conscious matter.
Well, thank you. That was really a great introduction. My first question is, how can we better understand pain-related suffering with a phenomenological approach? And I think I would like to start with the suffering mood. So please, if you want to expand on that.
Yeah, the suffering mood. Well, that is from a phenomenological perspective about that we can't really perceive anything without being in a certain mood. We are always in some kind of mood, or Stimmung, as Heidegger writes. And this is affecting. It's like coloring the world, sort of. So, for instance, when we talk about depression, we tend to talk about a perception of life that has lost its colors. And well, that may be true in some cases, but we don't have any objective colors of the world. The mood sets everything for us. So the mood, the affective states, the state that we are in, um, sort of makes the world come alive, I would say. And
Yeah.
if we change the mood, then the world changes. And that's, I think, it's an important aspect of phenomenology.
Yeah, and specifically with pain-related suffering, I think it would be interesting to get closer to pain specifically. I understand it's far from your expertise,
Yeah,
but I am doing interviews with participants that live with chronic pain right now.
interesting.
Yeah, especially in phenomenology, because I'm trying to get at the suffering mood in a way, and also at the stressful aspect of pain that might lead to suffering.
That's great. That's a very important research, I think.
Yeah, thank you. But I guess I could maybe bring some preliminary results with you, and maybe you
Yeah,
could help me understand them better in this
yes,
context.
please do. Please do.
Because I definitely think you have a high level of understanding of phenomenology and the embodied experience, and I think I can learn a lot from talking about these with you.
We'll see.
So, um, I would like to start there with participants. Often I find it's really difficult to get to the idea of mood, simply that concept.
Right, right. Why is that difficult? In what way?
I often it's probably the questions I ask their own questions, but um, I often find people tend to answer with not always, but with things that happen to them. You try to ask about the mood, and they just say what they did. They
Yeah,
describe what they
yeah.
did,
Right, right.
and I don't think that's exactly getting at the mood. It's part of the mood.
It is definitely part of the mood, and I think um, w- part of what makes it difficult is probably because it is difficult to describe one's own mood. Uh, because generally our attention is not directed inwards, it's directed outwards towards the world. And from a phenomenological perspective, the lived body is already in the world. So we can't really look at ourselves like that. So I think in order to try to get a clearer view of, for instance, the mood of pain, we have to take in the world that the person moves in, so to speak. How does that world look? So it's more about that than about how it feels inside.
Interesting.
For
So
instance,
yeah,
uh, I've understood that some people with chronic pain can, I don't know if you have encountered that, but I guess you have, that the pain can create a kind of alienation towards your own body or your own self. And since we are entangled with the world itself can begin to feel unhomelike. Uh, and if the body and the world is unhomelike, then I mean pain also affects the language. So it will be rather hard to describe such a world. And maybe that's why it gets difficult. Because if you feel a little alien towards yourself and your place in the world and the world, then how can you describe that in a way that makes sense? It's really difficult.
that's a great answer. Thank you. I would follow that up with, for let's say somebody listening, how can a better understanding of that pain-related suffering mood um, could be helpful one day? Or I don't think that's the right question, but more like, why is it important? What can mood help us understand better? I think, yeah,
Yeah, I think that it's a good question. Not sure how to answer, but I think this sense of alienation is quite crucial. Um, and how can we help people with pain to feel less alienated in the world? Because that's what pain can do, and it generally affects the pain affects our sense of meaning and purpose and direction in life. So when you're in pain and you try to describe what mood you're in, you probably describe it in a negative way. And I don't mean negative like emotionally negative, but like a negativity, like a lack of something. It's like a lack of meaning, a lack of purpose, a lack of feeling at home in the world. So those kind of feelings could be something to pick up on, I think.
yeah, I think that's a great answer. Thanks.
And also, when you try to formulate that, when you try to formulate something that is based on a negativity, which does, I mean, it's the opposite of something that exists, which is really tricky. Then I think it's about just trying to do it. The process of trying to put a language on something that doesn't have a language. I think that could be really helpful. And that's my experience as well, not particularly with patients with chronic pain, but with other kind of problems that are really hard to put into words, other phenomena, that just doing it and keep trying to do it creates another sense of being at home with yourself and in the world. So that's one part of it, I think.
Yeah, no, thank you. I really appreciate the depth of that answer. That's helpful, really, for me and many people.
Yeah, well, I think because what happens is that when you have difficulty describing things, it's also because these things may not even be there, because your perception, when you're affected by something that is painful or very, very disturbing, is limited. So it's not only that we perceive the world in a certain way when we're in pain, it's also probably that we don't perceive much. That there's a lot of things that go on that we don't see because we are so involved with our pain. So it's about talking what isn't there in a way, which sounds paradoxical.
But phenomenology can allows us to get to that in a way.
Yeah, I think so, definitely. And that's also, I think, in a way, an epistemological stance regarding phenomenology versus science. Is when you look at something phenomenologically, you try to have a not knowing stance, as we were talking about before, which means to be open and exploratory and not taking anything for granted, trying to be unprejudiced, which is, of course, very hard. And we can never entirely understand another person because we can't fully perceive the world in the same way. Not just because we have different backgrounds, experiences, and personalities, but also because we are never entirely in the same mood as the other person. So, this is something to keep in mind in clinical practice, to try to be not knowing. And there are many pitfalls there.
Yeah, yeah. That's a good point to make, and that makes me wonder, when we study these moods,
Hmm.
we are usually not in the same mood. But how close can we get to an understanding of a certain mood?
Yeah, well, I think we can get pretty close by just being very open and very curious and be aware of the fact that we are not knowing. So that's as far as we can get, I think. But
Yeah.
I think it's quite fruitful to do that. That's my experience, at least.
Oh yeah, yeah, I agree.
Because there is, as I mentioned, there are pitfalls, and I mean, there's always the risk that we are not seeing the other person as an other, but as the same as ourselves, that we relate to our own experiences. And I mean, manuals, psychotherapeutic manuals, for instance, and agendas in clinical psychological practice, they can be helpful, but they can also obscure. They can obscure the other's uniqueness. So we have to be really aware when we use manualized interventions and things like that, that it can actually make us see less and understand less.
Yeah, that's a good precision to make, and I think that's just uh, also in our nature. I think is to believe that people understand things the same way we do, and until
Yeah,
we understand otherwise.
exactly. Yeah. And maybe that has some kind of a point as well, because we want to feel connected to other people, and we like to think that other people experience things the way we do. But
and
that's not the case.
and I think pain tends to make that very clear for people.
Yeah, definitely. And probably one of the factors that makes it really hard to live with chronic pain, because you feel disconnected to other people because they can't at all understand what you are feeling and what state you're in.
Yeah, and that's exactly why I think phenomenology is interesting, because I think in a way it tries to do exactly that, just
Yeah,
to get closer, even if it's impossible to really understand what somebody else is feeling. It out at least gets us
yeah,
closer.
right. Yeah, definitely.
And I think that's a perfect segue for the next subject I wanted to bring. It's
Uh-huh.
melody and attunement.
Oh, yeah. For instance, Levinas, who is phenomenologist, at least in the early writings, he doesn't write about pain, but he writes about, for instance, fatigue and shame, which is a very strong affect, and sickness, feeling sick. So, and he describes these feelings or states as something that interrupts the melody. Uh, it sort of breaks into our beings and reminds us of ourselves. So instead of just going on with our usual business, we are interrupted. And when we are interrupted, according to Levinas, we realize something. We realize something about ourselves and our position in the world. We realize, for instance, that we are vulnerable and that we are dependent on each other and things like that, that we just take for granted or don't think about in everyday life. So it's a kind of a state of rupture in our being in the world. And it's the when the melody breaks, we see something behind the melody, sort of. Um, and I don't know if he wrote anything about chronic pain, but I don't think so. Um, but when we are in physical pain, we become aware of the body in a different way, as suddenly the body it comes forward and in the foreground, and it becomes the foundation for our being. We realize how important the body is. So usually when we go about our daily lives, the melody just keeps going on, and we don't reflect on this vulnerable state that we are in existentially. So it's the rupture of the melody that's quite interesting in that sense, and what that um, provokes in terms of moods and states. I think just add something that Levinas writes about these strong states that we can suddenly find ourselves in. That uh, and I think that would be also relevant when it comes to living with pain. That we realize that we have an obligation that we haven't chosen. That's his expression, which is life, life itself. We didn't choose it. We didn't choose to be born. Now we're here and we just have to deal with it. So that's basically what it's about. And for most time we're in some kind of melody and we don't reflect upon it. But suddenly we realize, oh, here I am and I'm obligated somehow to exist. And I have to try to do that in the best way possible.
Yeah, I think I would like to bring that back to the participants I interviewed. Some participants, they seem to have high levels of pain that would limit their function, and yet they seem attuned to that experience. They seem to accept the pain and live a fulfilling life. And meanwhile, there are other participants that are brought out of their life experience by chronic pain, and they seem to be hitting some sort of walls. And if I can use that analogy, so I wonder if this could be explored maybe more in depth with the concept of melody and attunement.
Yeah, probably. I think that's usually connected to, I think, well, it's hard to explain why it's so different, but people are different, so you can just take it from there. But um, if you have chronic pain and you're still sort of attuned, you're still sort of within the melody, and you don't experience much disruption, I guess you have sort of been able to um, be in the world without being controlled by the pain. Because the pain is like a very strong message that is usually interpreted as something is really wrong and you have to be really careful and you have to avoid a lot of things and you have to stay put and you just shut yourself in. And if we listen to that message, which is very convincing, then I guess it's hard to take control of the pain if it's possible. I mean, in some sense, it should be possible. As you describe it, some people can really be in the world and still they have their pain, but they are doing other things. So it's about um, shifting focus, I think, shifting the attention, which is not easy. So we have to really respect how difficult that is. But try to shift attention from the pain to the world. Then you shift attention from the body to the melody, so to speak.
Yeah, that's an interesting way to explain that and explore that.
It's a difficult task for anyone, I think, to do that. But there are research results that points, as you know, to the possibility of working psychologically to reduce pain. But the thing is, the pain is not reduced. It's how we perceive it that's changing. So when we are in pain, we tend to change our life patterns, the way we go on in everyday life, which ultimately changes our being in the world. And we tend to reduce and avoid. And it follows us everywhere. So when it comes to pain, there is no point in avoiding because you won't get rid of it, whatever you do. So it's really about, generally, I think, about reducing avoidance and reducing all these strategies that we have developed to deal with pain, and instead sort of shift the focus out into the world, no matter um, how you feel, so to speak. It's a within acceptance and commitment therapy, which is one of the therapeutic methods used to work with pain. It usually starts with acceptance, which is the sort of baseline to try just to accept, which means not to be happy about feeling pain. It's just being neutral. sort of giving up the resistance, and in a non-judging way, just let it be, just let it exist. And then from there, try to reduce the activities that aims at avoiding or controlling or reducing pain. And instead, which can feel really awkward, try to go along with activities that you may perceive as a risk of increasing pain. Still doing them, because there are activities in every person's life that can give a sense of meaning and purpose. And when we're in pain, we tend to give up exactly those activities. So, as Stephen Hayes put it, Stephen Hayes, who is one who developed the relational frame theory, which is the theoretical background to acceptance and commitment therapy, he says it's about leaving the waiting room. Which waiting room as the metaphor when you wait at the doctor's wait, and you can't get rid of your pain, to leave the waiting room.
Yeah, and I think I might be able to add to that from speaking to participants who have done something similar.
Yeah,
What I notice is that often it involves changing the activity, adapting it, because some people try to maintain the same activity they were able to do before the pain, and I think
right,
that puts them up against walls that are insurmountable sometimes, while
right,
those
yeah,
that finds a way to still create meaning through maybe different activities or similar activities but
yeah,
modified.
yeah.
Mhm. I often see those seem to live
That's
a life
very
that's more
interesting.
fulfilling.
Yeah, yeah. So, isn't that also about questioning your life in a way, which I think happens when you have a problem as chronic pain, or I can compare it to something that I worked a lot with, exhaustion syndrome, and people who get exhausted, that you can't just rest and then get your energy back and keep doing the same thing. You have to start asking yourself, what is important? uh, what do I value in life? And from there, try to find a direction. So it's that's I think it's a good example that you're bringing up. I'm curious about acceptance and commitment therapy as the sort of practical way of using this theoretical system, which is very much about the acceptance, of course, as I mentioned, but also about reinterpreting, which is something I think it's easier to understand. I think we all know that we interpret things all the time, and sometimes we are more correct, and sometimes we are less correct in our interpretations. And when we are in a mood, and we are always in some kind of mood, that's how we see the world. Uh, but if we try to rephrase the perceptions, then we can also affect the mood. So we can go from sort of go the other way around in a way. Instead of trying to feel in another way, which is almost impossible, we can try to, be aware of how we describe our situation. So it's also very much about language. What words do we use? What kind of narrative are we creating for ourselves? And that can actually affect the mood also, when it comes to pain. And there is no manual for that, I think, because it's very individual, how we can find a way of, for instance, describing the world of pain. I mean, there is no objective way of doing that, of course.
And I definitely think that's where phenomenology comes in, because I think phenomenology allows us to probably do that more effectively.
Yeah, definitely. Because it's very much about taking an interest in how the world appears to us. Because our mood makes the world come alive, and then the world appears to us in a certain way. And if we can describe that, and if we can try to use the language to find the ways of describing it that make sense to us and that can be of help to us, then I think that's really a very positive way of doing it. But it's difficult, of course.
Yeah, thanks. That's a very important thing to bring forward, and that connects to my next point: the world of the living and the world of the sick, which is tied to pain and chronic pain. So, first, just to help everyone understand this concept, how would you describe the world of the sick and the world of the living?
The way I perceive these two worlds are, I mean, as I said before, it's a sense of liberty when you're not in pain or you're not sick or you don't have a very depressive state or anxiety state. You have a sense of liberty. You move around the world. You're not so worried about how it's going to affect you. And when you are, for instance, in pain, then you reduce your world. It becomes smaller in every sense, and you avoid things and you don't do things. So it's a smaller world generally. I think that is a big difference.
And if I recall, the world is the possibilities that are present to you. Is that correct?
Yes, that's correct. Yeah, which differs a lot. I mean, between individuals. So
But I think it would be interesting to understand this in greater details, because when you hear that, it sounds like it's what you can do, the possibility, but it's not just that. It's the possibility that the meaning you create, right?
yeah, exactly. Yeah, that's a very important point. It's not like oh, you should do this and that because it's possible and everything is possible. It's not about that. It's about a sense of meaning, and the person in front of you is the only one who can answer that question. What is meaningful? Because it's so individual. It's so unique. It can be a very sort of small thing or something grand. It doesn't matter. It's about getting a sense of meaning in your life and activities, which doesn't have to be very energetic, but just activities that takes you in that direction will sort of make the world larger, open up the world again.
So interacting with the world would be to, not interacting with the world itself, but with the concept of the world would be to a change in meaning.
Yeah, that's what I have experienced in my clinical practice, definitely.
Yeah, that's something I'm really curious to hear more about.
Well, it's I mean, as you mentioned, I haven't worked with pain, physical pain. I work with other states, and um, when you're in a, for instance, depressive state, or when you deal with anxiety, you tend to shrink the world, and you get sort of controlled by the state you're in. Um, and this is, I mean, probably something that has to do with a survival pattern that we have these strong negative affects because we have to be aware of dangers, etc. In our lives. But so it's very convincing. So and then if you start to if someone asks you, but what do you really enjoy? What do you really feel has a purpose in your life? Or can you recall situations where you felt that? Then you get sort of a clearer view of some kind of path to follow. So it's not about telling the patient what to think or feel or do. It's more about exploring what is already there, what people already know. The patients already know deep inside what they need to have a sense of purpose in life. It is there somewhere, so you really have to be exploratory and curious.
Yeah, and to tie all of this together, my sense is that phenomenology allows us to get to those ideas and concept, and then to get to those is to allow the person to modify those in a way if they wish to do so. It's just to give them the
Yeah,
framework.
yeah, yeah. If they wish to do so, definitely. It's up to each and every one. But I mean, what happens in a therapeutic process is generally that the therapist's curiosity, because as a therapist, you are really curious about what's going on. So that curiosity, that not knowing stance, can also be transferred to the patient. So the patients start to feel a little more curious about the situation and about how to, modify it. So there is a very important relational component in that.
But I think just to understand if that's correct, that it's all based on the meaning that's created, and I think that's Frankel's argument.
Hmm. Yeah, yeah,
But just to understand that allows for a different world of possibility even for that person.
yeah. I think so. Yeah, well, that's what I feel when I'm working, uh, and it's vital, because the meaning can get lost when you're in pain or when you're depressed or exhausted, but it's not lost forever. It is there somewhere. There is a knowledge inside us, but you have to. Sometimes you really need to have a, a curious person that you can talk to in order to find that.
Yeah, it is interesting how, yeah, that outside perspective just allows you to go to those places where you've never been in your mind, but that are there all along.
I think that is it's very important to have that in mind because psychological clinical practice and psychotherapy is very much affected by psychiatric language and the pathologizing medical language. It has sort of evaded the therapeutic space, and it entails a risk uh, of forcing the patient into kind of ready-made formula, and we have to really keep that in mind and be aware of that risk and try to be as open as possible and trust the patient's own knowledge because it is there somewhere. It has been temporarily lost, maybe, but it is there somewhere. Working with chronic pain, maybe there are some vital differences where you can't compare it to other difficult states. So, and I think one of them is actually this that the pain doesn't go away. It's more about living with it. It won't go away for many people who live with it chronically.
That's an interesting point to make. I think that differentiate pain from most things. That
Yeah,
it's
yeah,
particular, yeah.
yeah. But also that makes it in a way more existential because if there is one thing we also can't get rid of, it's our existence. I mean, as long as we are alive, we are existing, and we have to carry that through. We have to deal with things that come up. So it's kind of related in a way to the existential foundation for our being. So I guess in that sense, chronic pain can be maybe the most existential way of being, actually.
In a non-life threatening way, yes. Yeah, I would definitely think
Yeah.
that's an interesting thing I haven't studied or read about yet, but I definitely think that would be important to bring more into the discussion.
Yeah, I think so too. I think maybe Levinas would be a relevant thinker in that sense, since he wrote a lot about, this pain of existing. and how it's not only a pain, of course, but he was focusing on that early in his thinking, and how he compares it to a big suitcase that you carry around, and you just want to get rid of it because it's so heavy and it's such a nuisance to carry it around. But in that case, there is so much you need, so you can't get rid of it. And this ambivalent state that puts us in on an existential basis. It's hard to live, it's a lot of obstacles, and at the same time, this is what we got. And when you're in pain, that is really, the baseline. This is what I got. I got this pain and I have to carry it with me, but still be alive, still be in the world.
Yes, because something we've been discussing recently in my research group is the difference in the forms of suffering. And I definitely think that that's a key aspect that should be discussed. And it's probably been discussed in other books or articles, but it's important to bring it up in this discussion.
Yeah, but I think it's like we were saying there at the end, that there is a difference, that pain is special in that sense, that it doesn't go away, because most states that I work with, it goes away, so, and there is an after.
Yeah.
So that's an important difference, I think.
Yeah, I think it's important to just bring it up in the conversation. Like I said, I'm not sure what to make of it, but I'm really glad you did, just because I don't know why it didn't came up earlier, and I'm sure it did at some point, but not in this
Yep.
salient way.
Right.
And I mean,
I had a headache for 2 weeks,
yeah,
just like a horrible headache, and it didn't. Usually, if I have a headache, I take an aspirin and it goes away, and I don't think about it. But this just lasted for 2 weeks, so I thought it was chronic. So after a week, I thought, I'm not going to get rid of this. And I was thinking about your research and about this coming podcast session, because it's so funny that you see everything differently when you have a pain like that, completely, and it affects everything you do. How you talk, how you walk, what you choose, what activities you choose. Crazy, how susceptible we are to that
yeah, and
experience.
it's also impossible to imagine. It's one of those things where even
Yeah,
if you've had it, once it's gone, it's really hard to get back into that mood and
yeah,
state.
yeah, you forget it.
Yeah, yeah. Thank you, Mikael. I think that's a good note to end the podcast on. So thank you very much, Mikael, for participating in our podcast. And thanks to our listener for tuning in to this episode of Let's Talk About Pain, and see you soon. Bye.
Thank you for listening to Let's Talk About Pain. Don't hesitate to subscribe so you don't miss an episode, and to share the podcast with your friends. For more information, visit our website at qprn.ca or our YouTube channel by searching Quebec Pain Research Network. See you next time.